So, welcome everyone. My name is Christina Clark Okarmus. I'm the Executive Director at the Alabama Campaign for Adolescent Sexual Health. Thank you for being here with us today. I'm always so glad that people choose to spend their lunch hour with us on one Tuesday a month. So thank you so much. I am going to be presenting today. I know that's not what the norm has been for the last year or however long we've been doing these monthly webinars. But I wanted to look at the data and share some updates with y'all. Some things maybe you have heard in a previous webinar or maybe aren't all that new, but we are updated on most things through 2019, which I know feels like several years ago. I mean, that was pre-pandemic, for goodness sake. But we, health data just takes a little bit longer to get to us. So we are going to be updating y'all on everything we can and sharing some new things. So as we get started here, welcome everyone. Just to give you an agenda so you know where we're headed. I'm going to provide a few updates on the Alabama campaign. We've updated our vision and our mission and some of our core values. So just want to give you all those. I'm also going to give some updates on laws and policies that affect sex education in Alabama. There are lots of laws and policies that have been passed in this last year that affect sexual and reproductive health generally. And so just want to talk about those for a little bit. Then we're going to give an update on sexual health behaviors and outcomes in Alabama. Some of this, again, that's where we'll see, 2019 and later. And then talk about the support for sex education in the state. That support, you have probably seen that data before, but I'm just going to touch on it again. And then we'll, I don't have this on my agenda, but I do have it in my slides that we're going to look at next steps and how you can be an advocate for comprehensive sex ed in Alabama. So, like I said, you're all muted currently, but if you would like to come off mute at any point, just go ahead and do so. You can stop me and ask questions either by coming off mute or in the chat. I'm good with all of that. And if I don't get to your question in the chat while we're moving along here, it's only because I didn't see it, but I will be definitely checking at the end. I have a section for questions, so y'all can ask those there. So with that, we're going to go ahead and get started, and I am just doing my best to keep putting people in the room, so don't mind me if I'm look a little scattered. It's just because I'm trying to add participants as they show up. Okay, so before we do anything, we're going to do a little pop quiz. I wanted to make this a little bit interactive for y'all, so let me find my quiz option. This might take me a second, y'all. I'm so sorry. Polls, there we go. So I'm going to launch this. It's 8 or 9 true false questions. So as you see it come up on your screen, take your best guess. I just want to see where people are. All the answers will be revealed. Don't feel silly if you're wrong. We will talk about all of it. It's 8 questions, so just move through those as you can. Great, starting to see some answers. I'd love to say there's no right or wrong answer, but there certainly are, but don't feel bad if you don't get it right. These are actually anonymous. I can't see who has it right and who has it wrong, and neither can your fellow participants. So there's nothing to be ashamed of. That's what these webinars are for. They are for learning. We're almost at 100% participation. I'll get to 90% and then we'll talk about some of the answers. Okay, so let's talk about these answers. I'm just going to give it a few more seconds in case this last person wants to submit theirs. Don't want to end the poll prematurely. All right, I'm going to go ahead and end it now. I apologize to that last person if you weren't able to get it. So I'm sharing the results. Hopefully you can see that on your screen. If you can't, I will be talking through them. So question number one was, or I'm sorry, it's a statement, it's not a question. So statement number one was Alabama's sex ed law is an abstinence only law. We are really 50-50 on this. So we're going to talk about that. But the short answer is that is false. We are not an abstinence only law. We do not have an abstinence only law. We are not an abstinence only state. So I just think that's really interesting that we're 50-50 split. So we'll talk about what the law says shortly. The second statement was Alabama's sex ed law includes homophobic language. So you have three options here. 25% at true, 25% at false, and 50% at false, but it used to. That last one is the correct answer. So false, it does not include any more homophobic language, but it used to. So we're going to talk about that. Alabama educators all use the same sex ed curriculum approved by the state. 25% said that was true and 75% said that was false. The falses have it. That is correct. There is no sex ed curriculum approved by the state, and we'll talk through what that looks like practically. And so let's see here. Number 4, HIV prevention education is required in grades 5 through 12. 50% true, 50% false. That is true. We will talk about that mandate as well. Number 5, only about 20% of Alabama high school students have been tested for HIV. So 63% said that's true and 38% said that's false. It is true that only about 20% of Alabama high school students have been tested for HIV. Alabama has 5 cities in the top 100 US metros with the highest combined HIV, chlamydia, gonorrhea, and syphilis rates. Almost 100% said that was true, and it is true. We do have the honor, joking, of course, of having 5 cities in the top 100 US metros. Number 7, almost 100% of parents of school-aged kids in Alabama think that their child should learn about condoms. Is that true or false? Only one person said that's true, but it is true. And we're going to talk about that data. And then number 8, LGBTQ students have similar sexual behavior data when compared with their heterosexual peers. Evenly split, 50-50. It is actually false. They do not have similar data to their heterosexual peers. Their sexual behavior is actually, I don't want to say worse, but it's more negative. There's higher instances, I guess, than with their heterosexual peers. So again, we're going to talk about all these things in our presentation today. I just wanted to see where folks were at. So I hope that by the end of this, you will have learned something. So I'm going to stop sharing that. Thank you so much for participating. Okay, so the first thing on our agenda was to talk about some of the updates that have been happening at the Alabama campaign. So let's do that first. We have, like I said, recently updated our vision, mission, and core value statements. I see one of my board members, Sue Jones, on our call. So Sue was part of that. So our vision statement is that we envision access to comprehensive sexual health for adolescents in Alabama. This is a big step for us. We have not always talked about comprehensive sex ed and comprehensive sexual health in terms of adolescents in Alabama. And we have a lot of time relied on language around evidence-based or evidence-informed programs, which are very important. But really the gold standard now as our work evolves and gets better is comprehensive sex ed. And we'll talk a little bit about that. Our mission is to champion healthy adolescent development through medically accurate and equitable sexual health education and services. It was really important for us to keep that medically accurate language that we've used over and over and over again, because a lot of times the sex ed that young people are receiving is not medically accurate. And so we want to make sure that we are always falling back on that medical accuracy. And then equitable was another word that was really important to our board. Equity, of course, meaning that the playing field is not only equal, but that it's giving access to everyone who may be further behind than others. So it's kind of leveling the privilege field in a way. And you can read more about that online, but that was a really important word, even more important than being equal would be to be equitable. So then we have changed our core beliefs, and so we have I think 6 or 7. So I'm going to go through those quickly, but I just wanted to let you know sort of where we fall in our core beliefs as the Alabama campaign. So we believe in the capacity of youth and in supporting that capacity through information, education, and empowerment. We believe in access to medically accurate and comprehensive sexual health information and care. We believe in the support of parents, caregivers, community-based organizations, schools, faith communities, and policymakers in addressing adolescent sexual health. We believe in the diversity of opinion and the power of partnership to affect positive change for adolescent sexual health through advocacy and awareness. We believe in providing support for pregnant and parenting adolescents for the development of healthy families and strong communities. And we believe in providing sexual health education that addresses the diverse needs of adolescents in Alabama, regardless of race, ability, socioeconomic status, sexual orientation, gender identity, and expression, and faith. So these are the core beliefs of the Alabama campaign. If you have any questions, pop them in the chat. I'm happy to talk about them. But these were the core beliefs that came out of our board retreat in this past October. And I'm really proud of the work that our board did to create this, this foundation for the Alabama campaign. So moving on, let's start talking about some of these laws and policies that are in place that affect sex ed in Alabama and affect the behaviors and the outcomes that follow. So first, let's start with the sex ed law. So some of you thought that we had an abstinence-only sex ed law. So the first thing to know about our sex ed law is that it's not a mandate. So you don't have to teach sex ed, but if you teach sex ed, then you have to follow several guidelines that the state has lined out. The law identifies minimum content to be included in the sex education program or curriculum. So I always say if the minimum is emphasizing abstinence, then you can go above and beyond that. That's just the minimum. The minimum in a lot of these state policies is emphasize abstinence, but it doesn't say you can't talk about anything else. And in fact, the state law requires that you do talk about other things. So our state law requires that you provide statistics based on the latest medical information that indicate the degree of reliability and unreliability of various forms of contraception, while also emphasizing the increase in protection which is afforded by these various contraceptive measures. So that means that if you teach sex ed in Alabama, then you have to talk about contraception, including condoms. So just to reiterate, this is not an abstinence-only law. The law does say that you have to emphasize abstinence, but it does not say you can only talk about abstinence. The law stipulates that the course material should be age appropriate. It doesn't give a lot of guidance with that, but the Health Course of Study does give a little bit more guidance. And the Health Course of Study sort of mirrors the law in that emphasizing abstinence language. There's information in the law about sexual abuse and what should be provided to victims of sexual abuse. So there's some good language there. So this is the abstinence part that the law requires. So abstinence from sexual activity outside of lawful marriage is the expected social standard for unmarried school-age persons. So if somebody is teaching sex ed, they are required by the law to sort of hold this value, hold this standard for the young people that they're working with. For us at the Alabama campaign, abstinence is simply a tool in the toolbox. There are lots of other tools in a young person's toolbox to protect their sexual health and their overall health. So we don't particularly agree with this aspect of the law, that there's this expected social standard. It may be expected for some people, it may not be expected for others. But and then I just always think it's interesting for unmarried school-age persons, like that means that we are okay, and guess in some circumstances that a school-age person would be married. So that's just odd language. But we're not 100% in agreement with this, but we do think that abstinence is a tool in the toolbox. And so that would be part of a sex ed curriculum, but not the only thing that is part of a sex ed curriculum. Oops. Are there any questions about this sex education law that we have on the books? As you can see, it's quite old. It was developed in 1975, I should say. If you have questions, drop them in the chat. I'm going to keep moving forward. But hopefully the big takeaway here is that you all know this is not an abstinence only law. If you teach sex ed, you have to emphasize abstinence, and you also have to teach about condoms and contraception. You can't do one without the other. So it used to be, we talked about this in our poll as well, it used to be that there was some homophobic language in the sex ed law. And I apologize, I struck this out to make it look like, to indicate that it's been struck from the law, which is great, but it is a little difficult to read. So I'm going to read it for you. The law used to say that there had to be an emphasis in a factual manner and from a public health perspective that homosexuality is not a lifestyle acceptable to the general public, and that homosexual conduct is a criminal offense under the laws of the state. As I hope most of you can see why that is such a problematic thing to have as part of our sex education law. It's problematic, it's harmful to young LGBTQ people. And so advocates, including us, worked for many years to remove this language. A big thanks to AIDS Alabama, ACLU, other organizations that were part of this win, but we were so happy to see the removal of this language. So hopefully, well, we'll talk about some of the policies that were enacted in this last legislative session, but in theory, young LGBTQ people are safer in the classroom because of the removal of this law. Or I'm sorry, the removal of this language. The new law also does ensure medical accuracy of sex education, believe it or not. There was not language in there about medical accuracy, that a sex education program had to be medically accurate. And so the new law doesn't include some of that language. Moving on, we had a question in the poll, or a statement in the poll, about HIV/AIDS education. So there is an HIV/AIDS education resolution that was adopted in 1987 by the State Board of Education, that AIDS and HIV education are included as part of the approved health education curriculum in Alabama for students in grades 5 through 12. So that means that starting in grade 5, there has to be some discussion about HIV and AIDS prevention. Now, the state does not give any funding for this requirement. In fact, we'll talk about funding here in a little bit, but there's no funding for sex education in the state of Alabama. The state does not give any funding. So the state has this resolution, but it's unfunded, which makes it difficult for educators to get professional development, difficult to get materials that they might need to teach effective prevention education. So they're required to do this. And then there's no real guideline around what all that should include. Does that mean, I guess, speakers should come speak to the young people? Does that mean that the educator needs to get some professional development and do it themselves? Is it a unit that takes several days? Is it a 1 hour thing? So it's kind of all over the board, which I think you're going to see is kind of the state of our sex education in Alabama altogether. But we do have this resolution on the books. So in theory, students in grades 5 through 12 are receiving some information on how to prevent HIV and AIDS. What I think is funny, and my predecessor, Jamie Keith, would always say this, is sex education is not required, but HIV/AIDS education is. And of course, we know that one of the primary ways that HIV is transmitted is through unsafe sex. And one of the primary prevention tools is condoms. So in theory, you can talk about HIV prevention without talking about condoms because sex education is not required. So she would always mention that, and I just find that very interesting. I'm going to look in, yes. So Sue pointed out that the Alabama State Department of Ed, I wasn't going to throw them under the bus, but since Sue did, I'm going to talk on it. They do not monitor this requirement. They used to. We are working to find out why they stopped monitoring this requirement. It used to be there was like well, there still is, I guess, a requirement form, and someone from State Department of Ed would come through and check off all these things that are required. And yes, you have a unit on this, you have, a plan for this on your lesson plan. And HIV/AIDS prevention education used to be part of that. They've removed that from their monitoring form. So there's nobody monitoring to see that this resolution is being met. So that's troubling for us because now we at least used to have this in our back pocket of, okay, well, we know somebody's monitoring the HIV/AIDS education is happening in some capacity. Now we don't even know that. So we are working with Alabama State Department of Ed to find out why that happened, how we can fix that. But thanks so much for pointing that out, Sue. An advocacy opportunity for sure. I also want to talk about some of the anti-LGBTQ legislation that happened in 2022. I do want to point out that we are not an organization that lobbies. So unfortunately, we are not able to message y'all and ask you to call your legislator for HB this or SB this, but we are able to talk about legislation that impacts our work, and we just can't ask you to make any actions on them. So I just want to let you know, I 100% agree, Amy, it does need to be monitored, absolutely. I just want to let you know that that's why we're talking about this, because this impacts young people, but we are not lobbying for or against these bills. I also want to point out that our board has adopted a position statement on care for transgender and gender nonconforming youth that you can find on our website that very clearly lays out our position on that particular topic. Okay, so the first bill I want to talk about is SB 184. This bill passed. It makes and was signed into law by Governor Ivey. So this law makes it a felony punishable by up to 10 years in prison to provide gender affirming care. SB 184 also forces educators to quote unquote out children to their parents. This law currently is being blocked in court. If anyone knows differently, please feel free to jump in. My last understanding is that this law was currently being blocked in court because it does not meet with the Biden administration's expectations for states that are receiving certain funding. So I do want to talk just for a second about what gender affirming care means. So for young people under the age of 18, all gender affirming care means is puberty blockers, which are completely reversible. You can stop taking them and then, puberty would be onset. And also in some cases, there may be some access to hormones, which again is reversible. If you stop taking the hormones, then it would reverse. There is no such thing as minors getting gender affirming surgery. So that would be a surgery that would remove genitals or add genitals, including breasts. And so I just want to point that out, that what this law requires is that doctors stop providing reversible care to minors because there is this fear, there is this false belief that there are minors out there getting irreversible surgeries. And that's just not the case. So I just want to point that out. Really troubling. I mean, that part is very troubling, but really also very troubling and harmful to young people is this requirement that educators would tell parents if their child is gay or trans. This, I'm sure you can imagine why this would be so harmful to these young LGBTQ students. They're often not safe. Well, I shouldn't say often. Sometimes they're not safe in their own homes. The data would suggest that it is more often than not, especially for young trans kids. And if you look up data on LGBTQ rates of homelessness and being forced into sex work, it's because they're not safe in their own homes. And so to require educators to tell parents that may not be safe for their young people that they're gay or trans is very harmful part of this law. Yes, I agree, Megan. I think a lot of the people in our community do not understand what gender affirming care means, and it absolutely can be misconstrued. So another law that was passed and signed into law, and it is going forward, is HB 322. This law bans K through 12 students from using bathrooms and school facilities consistent with their gender identity. So if you've been to one of our webinars in the past, even last month, we talked about gender identity, gender expression, sexual orientation. They're all very different. I don't have time to get into that today, but I would encourage you to go look on our website for some resources if you're not sure what gender identity means. Additionally, this law would ban conversations about sexual orientation and gender identity in classrooms in grades K through 5. So again, we're requiring HIV/AIDS to be taught starting in 5th grade, but we can't talk about LGBTQ people in grade 5. It doesn't even make sense. It's very similar to Florida's Don't Say Gay bill, but which you may have heard that phrase thrown around this last legislative session, but actually goes further because I think that theirs is only K through 3 and ours is K through 5. And what educators are concerned about is that this will have a silencing effect where there is no conversation about LGBTQ persons in the classroom at all, that those young people are not going to be safe. I've also seen some advocates argue, well, if we can't talk about sexual orientation and gender identity, then we also can't talk about, straight orientation and cisgender identities. And I think that's meant more to be tongue in cheek, but you can see how it would be problematic. So unfortunately, this is legislation that was passed just this past year. As I said before, the SB 184 is being stopped by the courts at this time. HB 322 will take effect this school year. Megan is asking, are classroom teachers responsible for health education in K through 5 classrooms in Alabama? I know that's how it is in many states. Yes, according to the health courses study, classroom teachers would be responsible for that content, at least in the traditional school setting. So yes. Now, whether or not they're the ones to teach it or they, call in somebody from outside, I can't say, but I can say that it is part of the health courses study. Okay, so moving forward, I want to talk briefly, and I do mean briefly, about what the Supreme Court just passed with Dobbs versus the Jackson Women's Health Organization, or JHU. And I'm only talking about this because, as you probably know, our organization does not typically talk about abortion. We don't have an official stance on abortion, but we do see that this case can impact a lot of the work that we do otherwise. And I do just want to give a brief overview for anyone who doesn't know. I assume all you do, but I'm just in case. So at the end of June, I guess it's been 2 or 3 weeks ago now, the Supreme Court decided Dobbs versus JHU essentially would overturn the right to privacy that was previously established in Roe v. Wade and again in some subsequent court cases. So overturned that constitutional right to privacy. And so that means essentially that those court cases that stood on the right to privacy are called into question. But the JHU case was specifically about abortion, a right to abortion through the right to privacy. And they decided that no, there's not a constitutional right to privacy and aspect, pertaining to abortion. And so it has called into question other cases that are based on a right to privacy. So cases related to marriage equality, to same-sex partnerships. I believe even the Loving case is based on the right to privacy, so interracial marriage. So it's very concerning that the court has decided that that is not a constitutional right. But for our purposes, here's why we're concerned about Dobbs. We already have, as you're going to see here in a few moments, a very high teen pregnancy and birth rate. Obviously, outlawing abortion, which, just so you know, Alabama immediately had what is called a trigger law. So as soon as Dobbs was decided, Alabama's trigger law went into effect. So it is illegal to get an abortion in our state unless the life of the mother, the parent, is at risk, or in cases of rape and incest. So we do have those three provisions, and I won't go into why that could be problematic as well. That could, doctors having to make these decisions may have to justify their decisions to others. And so that could be really hard for women to get the life-saving care that they need. But we already have very high teen pregnancy and birth rates. We will continue to see those climb if abortion is, well, now that abortion is illegal. Thanks for the question, Megan. Does this refer only to procedural abortions or the abortion pill as well? My understanding is that it also applies to the abortion pill, that telemedicine that would allow a person to take an abortion pill or medication abortion is also illegal. I was just looking up the law earlier, and I'm going to see if I can just pull up what I had earlier to check myself. So restrictions on abortion, the use of telemedicine to administer medication abortion is prohibited. So it does not say, I assume it will soon, but it does not say that a person could not order those pills online and take them without a telemedicine doctor administering. But it does say that the use of telemedicine to administer medication abortion is prohibited. So I hope that's helpful. And again, this is not really our bag, so I did have to do a little bit of research this morning, and I'll do my best to answer any questions. We also have a very high maternal mortality rate in Alabama that will only get worse with this if young people who already make up a very small percentage of abortions are required to carry their pregnancy to term. Young people are at higher risk for maternal mortality. The real thing, I mean, those two things are real and they're very troubling, but the real thing that for our work we are concerned about is what this can do to birth control access. So there are many politicians who are already calling into question birth control options like Plan B, which is emergency contraception. That's just the name brand. There are several other brands of emergency contraception. Because there's not, it's not clear how Plan B and emergency contraception works. Does it stop fertilization? Does it stop implantation? If you believe that life begins at fertilization, then you may not be okay with emergency contraception. And so that is concerning. And then the IUD also works in similar ways. So like sometimes it stops fertilization and sometimes it stops implantation. And again, where you draw that line, delineate, it can affect whether or not you think that birth control should be legal, at least from a politician standpoint. So those two are, probably closest to the chopping block if anything like this were to happen. And then other birth control measures, of course, can also be called into question. They're going to be maybe harder to access because there is no more constitutional right to privacy, and previous birth control cases that allowed married women and then unmarried women to access birth control were all set along this precedent of a constitutional right to privacy that no longer exists. So birth control access we are concerned about based on this Supreme Court case. I'm going to move on because I did say I would keep this brief, but if you have any other questions, just drop them in the chat. So I'm going to talk about Alabama's K-12 health course of study, which is put out by the Alabama State Department of Ed. Their latest one was in 2019, so this is what the 2019 course of study says. This is not specific to things related to sex ed. This is just generally what the health course of study dictates for health education. So they say that literacy behaviors and skills addressed in this course of study are fundamental to understanding and developing optimal health for life. So we find that phrase very important because a lot of the health course of study, when it talks about sexual health and prevention, talks about emphasizing abstinence, emphasize abstinence, emphasize abstinence, which again, abstinence is a very important tool in the toolbox. But if we're studying optimal health for life, young people need to know about more than abstinence. They need to know in an age-appropriate manner about other ways to care for their sexual health. The health course of study also says that they want their students to obtain health literacy. So they say a health literate citizen obtains, interprets, and understands basic health information and services and is able to use health information and services in ways that enhance health. So again, we just think that this is very important as it pertains to sexual health and accessing services, which we understand can be difficult, but the health course of study is meant to teach young people how to access those services, how to access reliable information, even pertaining to sexual health. The 2019 health course of study describes the minimum required content. So again, that language about the minimum. So if here's the minimum, you can go above the minimum for a curriculum that focuses on the development of health literate citizens. The standards do not dictate curriculum or teaching methods. So one of the questions in the poll was whether or not there's a curriculum that everybody uses regarding sex ed. I wish that was true, but it's not. There is no dictated curriculum for any part of health, but certainly not for sex ed. And again, content standards contain minimum required content. They are fundamental and specific, but not exhaustive. So what that means is, again, minimum. So the things that they say should be taught are fundamental and they're specific, but they're not the only things that should be taught. That's what not exhaustive means. So if I need to emphasize abstinence, that's fundamental and specific, but that's not the only thing I need to do. I also need to give young people in an age appropriate manner information on other ways to protect their sexual health. So that's the health course of study. The health course of study also started in 2019 saying this piece of information specifically related to sex ed on the local level. It is highly recommended that local school systems develop and adopt a policy regarding the instruction of sex education content for their schools in accordance with laws, regulations, and resolutions in age and content appropriate contexts. So the important part of that is that the local school systems are developing their policies related to sex education. And I put this quilt here because it's patchwork. It's a patchwork quilt. And that is essentially what our sex education is. Everything is locally controlled, which I understand the importance of that. I understand the importance of that autonomy and not being told what to do from this, what specifically needs to be done by the state. But I also understand that because of that law or that local control, we have all kinds of sex ed happening across the state. Some places are doing ab only, some places are doing closer to comprehensive, some places are doing nothing, some places are bringing in a third party, some places are having an educator do it. Maybe it's a health educator, maybe it's a coach, maybe it's a science teacher. And so it is all over the place. And what's worse is it's all over the place and there's no requirement and there's nobody checking to see who's doing what. And so a lot of cases we don't know. We don't know what's being taught from school district to school district and even from school to school, because it can even vary within a school district, just depending on, you know, what that specific school may want for their young people. So for us, this is difficult to have this patchwork frame regarding sex ed. So let's talk about what we do know exists in Alabama. But unfortunately, what we do know exists in Alabama is outside of the school, because we don't know what's happening in the schools, except for anecdotally. So we do know that the state receives federal, what's called PrEP, which stands for Personal Responsibility Education Programming, and SRAE, which is Sexual Responsibility Abstinence Education. So they receive these two federal pots of money, PrEP and SRAE, but there's no money from the state for sex ed or sex ed related things like HIV prevention. SRAE by advocates is often called AB only, abstinence only until marriage. All these programs that used to exist are now bundled up into SRAE. So there are a few organizations in Alabama that receive this money. What happens is ADPH gets this money, and then they subcontract it out to organizations who work with young people. So Ala Health is in Montgomery County, and so they work in Montgomery County and some surrounding counties. Tuscaloosa County Health Department does some work with SRAE money, and Dallas County does some work with SRAE money. And then PrEP money, which PrEP is closer to comprehensive. It's still not comprehensive sex ed, but it's a safer sex approach, abstinence plus approach. So for our work and the work that we do have a preference towards the PrEP money. Tuscaloosa County Health Department also receives that money, as does an organization called Black Belt Women Rising, which serves Choctaw, Greene, Hale, Marengo, Perry, Sumter, and Wilcox counties. So ADPH, who administers this money that they get from the federal government, they do not give this money to school systems or to schools. They administer it to these community-based organizations who then are able to work with schools if their school district or their county allows it. But in a lot of cases, they're working on the community level. So they may be like Tuscaloosa Health Department works a lot with juvenile detention centers. They may be working with foster care young people. And so they're not necessarily reaching school children. I think it's very important to note that PrEP and SRAE reach less than 1% of Alabama's youth. So while it's great that we have this money and it's being administered in our state, we are only reaching 1% of Alabama's youth with this money. And again, there's no state money, so we're not reaching very many Alabama youth with sex education in Alabama. Because of that, we're going to see some risky behaviors. So you've probably heard me talk about YRBS, Youth Risk Behavior Survey. It is administered in coordination with the CDC and in our state with Alabama State Department of Ed. So what they do is they go in and they survey high school students in a specific state. So in Alabama, they survey several high schools, well, more than several, thousands of high school students, and they get a representative data sample and to determine what are the risky behaviors that youth are engaging in, not just related to sexual health, but other risky behaviors. We're just obviously more interested in the sexual health information. So in 2019, which is the most recent data we have, any day now, we're gonna have 2021 data. I'm very excited. In 2019, we saw a decline in the percent of Alabama high schoolers who had ever had sex. So it's still, close to half, but about 40%. The percent who had had sex before the age of 13, 4.5%. The percent of students who had sexual intercourse with 4 or more people during their life, which is 10.7%. And the percent of sexually active youth in the last 3 months, which was 30.6%. Some of these, the percent who had sex before age 13, the percent who had sex with 4 or more people during their life, they can feel a little value laden and judgy, but those we know are directly linked with poor sexual health outcomes. And so it's not so much that we're making a value judgment on those people, but they are collecting that data because it is directly linked to the outcome. We also saw an increase, these are good increases actually, And the percent who used condoms, so about 54% of young people who are engaging in sex are using condoms, or did use a condom at their last sexual intercourse. They may not be using condoms every time. I mean, we would hope, but. And then the percent who used any contraceptive measures, so that could be birth control pill, the patch, an IUD, a condom, any contraceptive measure at their last sexual intercourse was 87.1%, so quite high. Again, we don't know if they use it consistently and every time, but here's hoping. So that's great that we saw those increases. Also just want to share kind of comparative. So we were talking about current sexual activity in 2019 was 30.6, in 2015 it was 34.9. So again, we saw that decrease. Condom use, less students were using condoms in 2015, so about 4% there. Pregnancy prevention, you can see that increased as well. So this is something we haven't talked about yet, but HIV testing for Alabama high schoolers. In 2015, only 5.8% were being tested. In 2019, 20.3%, which is great that that's an increase, but we need testing so much more than that. Young people in high school are actually at, I guess, relatively low risk for HIV, but once they hit 20 to 29, their risk for contracting HIV goes up exponentially. They only make up like a small portion of the population, but they are almost 40% of all new HIV cases. So it's very important that young people understand the importance of testing and are able to access HIV testing, even in high school. And then STI testing, for the first time in 2019, they asked questions about whether young people in high school had been tested for STIs. 80.6% indicated that they had not been tested. So again, almost 20% that had been tested, 80.6% had not been tested. We really have to ramp up testing, access to testing, and talking to young people about the importance of testing. I will say, because we aren't seeing a lot of sex education, young people are coming to these conclusions on their own. They are figuring out how to use condoms on their own. They are figuring out how to access contraceptive measures on their own. So this is not because of us, the adults in the room. It should be, but it's not. It's because young people are going online and they're finding information that they need, but unfortunately they're not getting it from educators in Alabama. And because of that, because of those behaviors, we see the sexual health outcomes that we see. So this is a graph you've probably seen from us a lot. This is our teen pregnancy rate graph. You can see it's declined steadily for the last 10 years. It went up just a tick this in 2019, which is the most recent data we have available from ADPH. Also to note, we look at ages 10 to 19 for our pregnancy data. The rest of the country looks at 15 to 19, so it could make us look less than other states if you look at if you try to like compare, but I'm going to show you some comparative data and you'll see that we're actually quite high when you look at 15 to 19. So that's pregnancy rates. Our birth rate also has steadily declined, except for in 2019 it went up a tick. So not sure what that's about. Might just be nothing. Hopefully it's not a push upwards, although with recent changes to the abortion laws, it probably will go up. So this is the comparative data from Power to Decide, which used to be the National Campaign for the National Campaign for Teen and Unplanned Pregnancy. So you can see here that Alabama is number 5 in terms of the highest teen pregnancy rates when you're looking comparatively. Not surprisingly, a lot of other southern states are in this top 10 as well. And again, just to show you some comparative data, our teen birth rate was 24.8 when you look at the 15 to 19 age range. You can see some other data there, which we will share these slides for sure. To talk about some other outcomes, and I'm going to start moving quickly because I want to make sure we get through all of this before our time. Young people ages 15 to 19 account for only 6.5% of the total population in Alabama. However, they make up 31.2% of all chlamydia cases. 21% of all gonorrhea cases and 5.8% of all syphilis cases. So that's, I guess, in line with their age demographic, but it's very troubling that there's so much chlamydia and gonorrhea. And of course, those rates are probably lower than the actual rates because those rates are those who are being tested and treated, not necessarily all those that have those infections. And then in 2021, Montgomery, Birmingham, Huntsville, Mobile, Tuscaloosa, and Decatur were all on the top 100 of US metros with the highest rates of combined HIV, chlamydia, gonorrhea, and syphilis. This is not young people, this is the whole population, but I just think it's very troubling, interesting, both, that we have such a high rate of STIs and HIV in our state. This is what I was talking about earlier with HIV cases and HIV testing, that young people ages 13 to 19 account for 5% of cumulative HIV cases, so relatively low. But then you look at 20 to 29, I misspoke. It's only 25%, 25.9%, but it's still quite high. That's a quarter of all the cumulative cases in the state, and that's only that's 9 years of your life. So it just doesn't match up. It's very high for that age range. Again, I'm just going to talk quickly through this. I'm going to reveal all these slides. I got this from GLSEN, and if you were on our webinar last month, our friends from Magic City Acceptance Center talked about this at length, but I thought this report was very interesting and important for us to know about, that essentially young people in Alabama are not very safe in their school. I'm sorry, young LGBTQ people in Alabama are not very safe in their schools. The vast majority of LGBT students in Alabama regularly hear anti-LGBTQ remarks. So for instance, using gay in a negative way, like saying, that's so gay. Other negative remarks about gender expression, homophobic remarks, and it doesn't say whether or not they hear those from students or from adults, but you know, it's troubling that so many of our young people are hearing these negative, this negative language. Most LGBT students in Alabama experience anti-LGBTQ victimization, so that could include verbal harassment, physical harassment, or even physical assault. Many LGBTQ students in Alabama reported discriminatory policies or practices in their school. So that could include using the bathroom aligned with their sex and not necessarily with their gender expression, using a locker that aligns with their sex rather than their gender expression, schools not using their chosen name and gender pronouns, and others. And then many LGBTQ students in Alabama do not have access to in-school resources and supports. And in fact, that includes inclusive sex ed. So less than 1% reported receiving LGBTQ inclusive sex ed, which is something we are very passionate about in terms of comprehensive sex ed. And then there was a question on the poll about whether LGBT students have the same or similar health data than their heterosexual peers. So you can see here, this is from the CDC, this is national, this is not Alabama specific, but more lesbian, gay, and bisexual students ever had sex than their heterosexual peers, 45% compared with 38%. And fewer lesbian, gay, and bisexual students are having sex using condoms. So only 41% are using condoms that are lesbian, gay, or bisexual, but 57% nationally are using condoms. So these policies that we've enacted for LGBTQ youth are negatively impacting their sexual health outcomes. And there's new research that suggests that LGBTQ inclusive policies and resources can positively impact sexual health outcomes, as well as mental health, violence, and substance abuse. So it's very important that we start including these inclusive policies. Unfortunately, somebody mentioned in the chat earlier, it seems like we're moving backwards with the enactment of some of these new laws. They're not going to make our young people healthier in terms of sexual health, but even in terms of mental health, violence, and substance use. And with my last few minutes, I'm just going to talk real quick about the broad support for sex ed. So in 2017, we worked with University of South Alabama to commission a study. They did a phone poll of parents with school-age children who were they currently had school-age children in public schools. And you can see here that the data is striking. 82.7% believe their children should be taught sex ed in school. This was the question in the poll, that 98.1% believe it is somewhat important or very important that their children learn about the use of condoms. So I said almost 100%, 98.1% is awfully close. So these are parents that are eager for their young people to receive sex education in schools. Oftentimes because they're not sure how to do it themselves, or they're not sure, that they're going to say the right thing, or they might just be uncomfortable talking about this. I had a parent who was very uncomfortable talking about sex and sex education. And so that's the only place to get it is at school, or maybe in a religious community-based organization. But at school, you have a very captive audience. Sorry. And then moving to another piece of data, we also polled, the Alabama campaign polled children's policy councils throughout the state in 2017, asking them what would be ideal sexual health education for young people in your community. 82.5% expressed that sexual health education should include more than abstinence. And then when asked why they thought this would be ideal for the young people in their community, over 85% responded saying it was because young people are engaging in sexual risk-taking behaviors and they need this information. So at the community level, people that are working with young people know that they need this life-saving information and that they aren't receiving it. And so on the community level, people understand, adults understand. Now, whether or not that's implemented, we're not seeing that, but at least there's a broad knowledge that we should be working toward comprehensive sex ed. These are just some tips on how you can get involved, contacting your local school board or even your local school and finding out what is being taught with sex ed, advocating for comprehensive sex ed locally. If you are working with young people and you have the capacity to implement sexual health content, we have lots of resources, including our sex ed professional learning series online. So those are some sort of tips for what y'all can do next, how you can be advocates in the community. I know we are past time, so I'm not offended if there's no questions, but I do want to leave the space open. And if anybody needs to hop off, I totally understand. But if there's a question that I can answer now that I have stopped presenting the data, please let me know. And if not, here's my contact information. You can find us, of course, at our website, which is alabamacampaign.org, pretty easy. You can also sign up for our newsletter there. And you can find us on Facebook and Twitter at Alabama Campaign. So again, pretty easy. Sue asked if this is what I'm going to be presenting at Mega later this week. I will be presenting some of this at Mega, yes. I'm hoping that I will be able to get a little bit more in depth, but I think I only have an hour and I clearly used every minute of that today. So I'll have to tweak it and see what I can cut and what needs to be added, but it will be similar. If anybody's presenting or anybody's attending Mega and wants to come be my cheerleading squad. Thank you so much, Kelsey and Amy. I'm glad that it was helpful. And you all are free to jump off as you need to. I'm going to stay here for just a couple minutes to see if there's any questions. Thank you, everyone. I hope you have a great day. Yes, Kelsey, these slides will be available. I'm going to send them out. They'll be to you by the end of the week, as well as recording will be available. So if you have need to share this with a colleague, it will be available for them to view as well. All right, I'm not seeing any more questions. It looks like folks are leaving, so I am going to close the webinar. Thank you everyone for participating.